Good afternoon. On behalf of the British Medical Association, and as a GP, I'm proud to be here in defense of the NHS today, and I share with every single person here today an unshakable belief in the founding principles of our National Health Service. A health service that's comprehensive, free at the point of contact, and provided on the basis of need and need alone. This is BMA policy, ratified over and over again at our annual conferences. But it's also about values that give hope and inspiration as a model for other nations internationally, where patients are often left untreated or forced to dip into their savings to pay for care. Values that have generated goodwill and loyalty from NHS staff, from porters, nurses, or doctors who go beyond the call of duty daily in serving sick patients, whatever the pressures. Values that have placed the NHS number one by the Commonwealth Fund as the most cost-effective and most equitable health service globally. But these very values are under threat as never before, where political decisions, chronic underfunding, and austerity has left the NHS in crisis, paralyzed without capacity, without the staff, beds, GP surgeries, or community services to meet the health needs of its citizens. A service that has descended to the depths of patients queuing in ambulances outside overfull hospital emergency departments that haven't the space to see them. You know, it doesn't have to be like this. There is a choice. We are the 6th richest country in the world, and yet we trail comparative European nations by government choosing to spend £10 billion less per year on health. We're also under-doctored, having tens of thousands fewer doctors compared to equivalent nations, with one doctor for every 360 persons compared to an EU average of 1 per 288. We're underbedded, having the second lowest numbers of beds per head in Europe, not to mention cuts in social care that adds further pressure on our impoverished NHS. In a health service where our patients should rightly expect the best, is it not shameful that UK citizens cannot even receive average funding from the politicians who control the purse strings? You know, plugging the £10 billion shortfall to make us average would make a huge difference to our patients. It would pay for 35,000 extra hospital beds at a time when patients are suffering a waiting game, whether on a trolley, on an A&E corridor for up to 12 hours, or in pain for a knee replacement that's delayed by months. It could pay for 10,000 more doctors when 75% of hospital specialties have vacant doctor posts, and 1 in 3 GP practices have permanent unfilled vacancies due to GP shortages. More seriously, this is resulting in a crisis of quality and safety. Over 8 in 10 GPs say that excessive workload prevents them providing safe, quality care. This is a travesty of government policy that espouses safety as a priority in the NHS. Hospital winter bed occupancy can be as high as 95%, which the Nuffield Trust warns exceeds safe upper limits of 85%, increasing the risk of infection. Even the General Medical Council last year spoke of NHS pressures and funding squeezes affecting professional standards. Don Berwick, the international patient safety expert, specially commissioned by government in the wake of Midstaff's and the Francis inquiry, concluded, I quote, "Targets and financial management have taken precedence over delivering high-quality care, and yet the government has learned nothing with targets and financial balance still ruling the day in every hospital and STP, crippled by centrally driven demands of further savage cuts. Cuts which are resulting in fragmented regional access to services for patients, contrary to an NHS founded on the basis of national equitable care based upon need. And when we ask the government and the regulatory authorities to give us a hand, instead they just point the finger. The efforts of primary and secondary care staff, sometimes thousands in a single hospital trust, reduced to one crude and demoralizing CQC rating that pays no attention to wider financial constraints and gives no credit to NHS staff working under impossible conditions, expected to do more with less year on year. If the CQC really wants to hand out special measures, it should be aiming its fire at the government instead, which is starving the NHS by billions short of projected need, and which is directly adversely affecting safe, quality patient care and causing demoralization and exhaustion amongst its dedicated workforce. This is leading to an exodus of doctors away from the NHS, with 1 in 3 GPs intending to quit in the next 5 years, a 13% reduction in medical student applications in the last decade, and junior doctors leaving the UK altogether, a picture replicated with a workforce crisis in nursing too. And if the government fails to increase current GDP spend on health, things will only get worse, with a projected £20 billion funding shortfall compared to Europe in 2021. The BMA is therefore calling for decisive, urgent action. First, an NHS which carries out the extraordinary deserves at least to receive ordinary levels of funding. We demand from government an end to austerity cuts and give us the average European health funding and the £10 billion extra per year it represents. For the extra beds for our patients, for the doctors, nurses and staff to care for them, to reverse the disastrous cuts in public health. Second, we must bring an end to the damaging and divisive market resulting from the Health and Social Care Act. This is squandering billions of pounds in transaction costs and processes of competition, and put those billions back into caring for patients instead. Thirdly, we ask for hard-working, dedicated NHS staff to be respected and valued, so that doctors and nurses can give their all to the patient in front of them without undermining their professionalism and without having to live a lie that the NHS can continue to be a world-class service with second-class funding. We're all part of the NHS family. We're united by the values we share in defense of this great institution. We want to care and not have the means of caring continuously eroded. It's a privilege for doctors like me to work in and be part of our venerable National Health Service. And it's been truly a privilege to speak here today as part of a coalition arguing for a health service that's given the resources to care properly and decently for its citizens. Thank you very much.